Morning, everybody. I was just saying I'd quite like to stay. I'm not sure what Eyglo and Jack have done in here this morning, but I walked in and it was just really peaceful, really calm, and I'd quite like to stay in this oasis today. So if anyone needs me, I'm in here. It gives me great pleasure and passion to introduce Eyglo and Jack this morning. So I need to, because I'm not so familiar with titles and I don't want to get it wrong. I'm quite good when it comes to behavioural, mental, emotional health, but this has a bit of a twist to it. So Reverend Jack Abel is leading the spiritual care team at Caron. However, aside from that, and you've been a clergy and an ordained minister for sort of 24 years. He works across different communities. And from what I can gather, that's from interfaith. There's Catholic work as well. So the impact that Jack has, sometimes I feel I should ask and say, is it okay to call you Jack? But I know that. But has on different communities, on healing and showing the spiritual way is huge. And then the impact that he has within the treatment services, which is kind of, I suppose, sort of what we're here today with regards to helping patients. But not only that, it's helping the professionals understand the way and to feel comfortable with exploring spirituality with patients and with families. So the impact is huge and for me very important. And Eyglo, whose last name I'm going to pronounce as Bjarnadottir, is that right? Oh, I'm trying to be adopted by Iceland at the moment, and one of the terms is to be able to speak the language. So Eyglo is here. She, Hazelden are lucky enough to have her as the one of the lead spiritual counsellors, but Eyglo has worked across the world. And she is a counsellor. She worked with, all the heroin epidemics in different countries. You were in Denmark for some time. And I had the privilege of meeting her across a crowded room last year. And the vibe, the spirit of her is attractive. And that's really important when we're coming to talk about spirituality, about being relational and not being scared of the unknown. And these two absolutely harness that. When I first heard Jack speak, I understood it. It was welcoming. It wasn't it wasn't the unknown anymore. It all made sense. So, I'm so happy to have you here. And I'm so happy to have you here. And I'm just, not that I'm a big promoter of things much, but in fact, our journey continues. We're going to Iceland on June the 9th. And to talk about well-being and recovery, because obviously spirituality, it knows no bounds and it's ever changing. And for me, as somebody that's in recovery, it's had many different guises and that's cool. It's about continuing to kind of discover. So, this is a journey and it's a beautiful journey. And thank you for being here. Thank you.
Well, good morning, everybody. Thank you so much, Sam. That was gracious and generous. I always like to start in a way that some of you won't know the customary responses, but you could fake it. My name is Jack, and I'm an addict. Jack. See, now I feel better. That brings a certain dimension of identity forward. And the other thing, when I was laying asleep and not asleep last night, worrying about this moment, was wondering about how to bring a dimension of the sacred to our time together. And I didn't bring any incense, but I will hope that there's something about the content that will help us to recognize. A long time ago, there was a convention of distinction between the sacred and the profane, or the sacred and the mundane. And I think it's a false distinction. I think that the sacred is present within everyday experience. And so hopefully it can be present in a didactic and expository and discussional experience like this. So I'm excited to be here, tremendously excited, and grateful to be here with my friend and colleague Eyglo. And we've batted around our way of sharing the time together and cobbled together a presentation for you. And what we want to do is spend some time talking about our experience in working as professionals with a spiritual or theological preparation and clinical training and background, and how that has impacted our experience in the addiction sphere. So some of that's self-promotion, a way of our talking about our experience as spiritual care professionals and advocating for spiritual care professionals. But the other thing that we've come to realize, both of us from years in this work, is that in many cases, treatment professionals will not have access to spiritual care and theologically prepared professionals and have to kind of incorporate this work within their own clinical sphere on their own. And so I want to encourage and advocate for hiring people who have pastoral and spiritual and chaplaincy backgrounds, and I want to kind of take you into that world a little bit. But I also want to help you, if you're a person who works in the addiction sphere, to not be afraid of this terrain. I think that, and hopefully to also not embarrass yourself or us. I'm not saying that we don't embarrass ourselves either. Religious and spiritual care professionals come in a variety of flavors and have a lot of different styles and approaches. But Eyglo and I, it's interesting, in coming to become friends over the last 5 years and working with a group of addiction chaplains, have come to believe very strongly that there's a set of best practices, that there are some clear mistakes that can be made in approaching the spiritual with clients, patients, families, and institutions. And there are some very, very helpful tips and techniques kinds of things that we find in working with addiction chaplains in multiple institutions. These best practices are shared. They're kind of, we all have discovered them on our own because there's not a lot of formal training for addiction chaplaincy, but it turns out that those of us who work in the best reputation institutions in the United States, which is where our largest experience is, all have kind of stumbled upon the same set of core principles and practices that are necessary in order to do this work with integrity and with a kind of success. So I hope that's helpful for you and interesting. If not, you can flee or turn your streaming off. But that's our intention. And I work at a place called Caron Treatment Centers, headquartered in Pennsylvania. There we have a large residential inpatient treatment facility, 220 some beds, ages from 14 or 15 to 85 was our recent oldest patient, and specialized treatment for various circumstances, including gerontology, teenage, young adult, but also particular concerns like chronic pain conditions, special treatment for healthcare professionals, special treatment program for people who have been in lots of treatment. So we have a relapse unit where we try to explore what the recidivism into treatment has as its underlying cause and concern, and to help people have that experience be their last residential treatment experience and successful long-term recovery going on. So I'm excited about Caron. We do also have a Florida location, and we have offices up and down the East Coast. And we're a not-for-profit addiction provider. And at the site where I work, I'm the supervisor of a team of 7 chaplains. And so we're really proud of that. We have an embedded approach where the clinical chaplain is a member of the clinical addiction treatment team, and each spiritual care professional has similar training and expectations and guidelines operates with similar ethics, has a similar size caseload, and provides documenting within the medical record and is accountable in a very similar way to clinical professionals in other disciplines. So for us, the chaplain is not ancillary or in many ways not wildly different than the psychologist or the addiction counselor or the family practice person, but does bring different training. All of our spiritual care professionals have formal theological preparation, and that's means that we approach the same problems and challenges that people have with a different lens. So I didn't want to spend too long introducing myself for the subject, but I just wanted to put in context what it is that we're trying to talk about. And I'll let Eyglo explain a little bit about her background and experience at Hazelden Betty Ford, but she has fantastic experience at one of the United States' leading providers also in the nonprofit sector for addictions treatment. So we're excited to represent what we would think of as sort of best in class in addiction treatment in the United States here at this international level, and really honored to make the acquaintances that we've already had a chance to make, and great to be here. We have a bit of a structure to the talk, so this helps hopefully you pace and us, and parts 1 and 2 are a little bit more theoretical, and part 3 very much practical, and there's a part 4 there which is question and answer if there are folks. So I'm actually very comfortable if somebody wants to interrupt and ask a question in passing, that's fine with me also, or you can save a question or discussion item to the end, that would be fine. But Eyglo's going to talk to you a little bit about engaging clients around the subject of the sacred, and then I'm going to talk a little bit about kind of the flip side of that, which is where we look for understanding the sacred and where the patient or family or institution pulls from to understand what is authority in this context. And just like authority in medicine or psychology or psychiatry, other domains, there are pools from which one draws. In the work of a sacred professional, there are pools from which one draws. And then in the third, we'll talk a little bit about specific practices and how we approach working with clients to provide them methods to heal and grow in the spiritual domain. One of the ways I like to explain that is that we feel that spirituality and the psychological categories that we get from positive psychology, like flourishing, are correlated. So a person who's doing spiritually well would describe themselves also as feeling well and feeling very connected in their life, working and having meaning. Maslow's ideas of self-actualization also that are appropriate there as an idea of what spiritual wellness is. And I think many of us intuitively know what spiritual crisis is, but it also is something that can be assessed and diagnosed. And our third part will be about helping people move towards flourishing and self-actualization and a sense of healing and wholeness in their lives and better connections with themselves and others. So that's what it's about. That's why I'm here. I'm going to let my colleague take us into the heart of the matter, talking about how we work directly with patients and families.
Thank you, Jack, and good morning to all of you. It's absolutely wonderful to be here with you this morning. I'm Eyglo, Bjarnadottir. I'm a spiritual counselor at Hazelden Betty Ford in Center City. I'm stationed in Minnesota at the flagship for Hazelden. Hazelden has a wide range of services across the U.S., a lot of residential places, outpatients, and all sorts of good services. But I've been there in Center City in the Minnesota winter for 16 years now. That counts for something, I tell you. The ice just came off the lakes. So as Sam said, I am from Iceland, and I came to this work at Hazelden, sort of, fell into it after finishing my theology education in Iceland and not knowing necessarily where I was headed, but I am also a recovering person. I'm an alcoholic and addict, and I'm like Jack, I feel good saying that here. It's my part of my identity. So much to my pleasure. There was an opening and I was offered this job, and I've never looked back. So I get to work with alcoholics and addicts on this most intimate level, getting to connect with them in their woundedness, in their pain, and help facilitate what I see as the beginning of the healing. Residential treatment, short-term nowadays, shorter and shorter over in the U.S. Due to insurance issues. But it is a privilege. It's a privilege to get to sit down and connect. We talk about working with clients. I talk about connecting with clients, because for me, spirituality and spiritual work is all about connection. It's a relational reality. Spirituality is about relationships, and forming a relationship with a wounded person in a short period of time is challenging, but it is also tremendously rewarding, And that's what I get to do every day, every single day. It's a beautiful thing. Now, as Jack said, many of you may not have the privilege of having specially trained and educated spiritual care people, and that's why it's our passion to bring some of the methods, the ways that we work to you, so that you can better do what you do and incorporate the spiritual dimension into your work. So I'm going to go through a few basic but very, very important things about the context, the cultural, demographic, religious, and personal and social context in working with people. So examining this spiritual context is what we do. In an interview, in a sit-down, in an encounter, we start focusing in on how this person sitting with you, this wounded person, this person who's come to, in my case, Hazelden, a residential treatment, not necessarily knowing where they've landed, but they're here and they're there in front of you. And what I do is I start examining with them how they understand spirituality, the sacred, these important things, and how they themselves experience that, what they, what are their experience personally, but also in the greater context, what did they grow up with, what is in their family system when it comes to spirituality, and also sort of the world that they live in. We come from different places, and we have had different experiences. So we have to listen carefully to not make the mistakes of putting people into, just one mold. We have to listen carefully, and that's what a spiritual care counselor does. Looking with people at the background. This is about, where are you coming from? What has been spiritual and sacred in your life before? And believe me, you need to look into the most unexpected places. It is not necessarily on the surface. So, in the DSM-5, there is something called the cultural formulation interview, a very, very helpful tool to use to explore these things with people. It's a set of 16 questions that you as clinicians can use. If you don't have a trained spiritual care person, this is what we do. This is what our training is for, to explore this with people. But if you don't have a person like that, this is a way for you to approach this issue. So you ask people about their religious and cultural experiences. And you would be amazed, what you hear. But people may just say, well, I come from a Catholic family, and I'm not much for it, but it's where I come from. And even though the person doesn't identify themselves as being Catholic anymore, this experience, this background does matter. It has formed them, whether they like it or not. The same goes for all other different backgrounds. Then you have the person who says, I didn't grow up with anything, not at all. It's only last week that I have a young woman who said that. What do you mean, spiritual or even religious? Because she hadn't had any interactions like that in her life. So you start asking questions to find out if there is something else there that is relational, spiritual for this person. You ask about high points, so times in their lives when they've really felt connected. At what time in your life did you really, really feel connected? And what was that all about? And how did that, what was that experience? Where did it happen? How did it happen? Who were you with? Things like that in a conversation. And very often with the population, the people that we are serving, there are a lot of wounds. There are a lot of spiritual wounds, places, times, experiences where you felt alone, you felt disconnected, you felt like there is nobody else in the world like me, or even beyond that, somebody in authority, somebody in spiritual authority in your life has harmed you. You've been harmed by either religious institutions or religious people, or just people that you've held to high standards, who've been role models or mentors or people who you've trusted, and you've been harmed by them, and you don't trust this anymore. This is an important part of the interview, is to really hear this, to validate and witness and to hear the spiritual wounds, because that's often where the apprehension lies for a person, or the block, if you will. Now, an important thing to ask about is, how does this matter to you? Does this matter to you? How important is this to you? They might not feel that it is important at all. So to get to know how to work with a person with spiritual matters, you really have to kind of listen deeply, and listen and validate and really listen. What is this person saying? How important is this for them? A lot of people, as you know, come to recovery very, very disconnected. That's the spiritual kind of hallmark or wound of addiction, is that we become disconnected. So they might not even know if it matters. But with a little bit of talk, a little bit of connecting, a little bit of work, you really begin to see how, after all the disconnect, it really, really matters. There is something there that matters. It's deeply buried under the wounds of addiction, but it's there. And it's the job of the spiritual counselor, or your job as a counselor, to really help them begin to connect again with that meaning, that purpose, that those spiritual experiences that they may have had. So most places, like treatment facilities, and professionals that work independently do some sort of an assessment, intake assessment. And where I work, it's often done over the phone prior to the person coming, or face-to-face when they enter the place, or in stages. A quick one over the phone, a more deeper one when they arrive, and then, little by little, we get to know more about the person. So very often, what I see when I'm asked to meet with somebody, I see the medical record, and I see an identification in the category of spirituality or religion, and I see a label. I see, oh, here's a person that says that they are Native American. And that's how they answered that question on the questionnaire. And it is super, super important to go beyond that, to not necessarily take that at face value, to really, with the person in front of you, talk about that identity, that presentation, and not to just buy it as it is. Quite often, there has been such disconnect that they don't even know that that means anything anymore to them. Yeah, I was born into a Native American family. I grew up on the reservation. We have quite a few of them around where in Minnesota. I grew up on the reservation. There was not much spiritual, traditional, experience in my family. So I don't really know. Yeah, I am Native American, but the spiritual elements of it don't mean much to me, they might say. Or on the other side, they might say, it's super, super important. I really want to get back. I think that I'm going to die if I don't get back to my roots. So right there you have the difference between, no, it really doesn't register anymore with me because I've gone so far away. And besides, there was a Catholic school on the reservation, and it all got tangled up and mixed up in my upbringing, so I really don't know which side I'm on. I'm torn. So another example is, it says on the questionnaire or the medical record that this person identifies as atheist. And you listen to that. And then you engage them in a conversation about that. So what does that mean? What does that mean for you? How did you come to this? And very often, very, very, very often, there are some interesting, sometimes very complicated, very heartfelt feelings behind the label. And you have to listen to that. Sometimes there are wounds behind that, and sometimes there are just reasonable, very well thought through intellectual processes that have brought that person to that place. And either way, it matters for how you continue to work with the person. You have to know what's behind the label. Now, as a foreigner I'm a foreigner everywhere I go, seems to be, I've not worked in this field in Iceland, not in this capacity. So everywhere I go, I'm the immigrant, I'm the foreigner. So, there's a lot of things to learn for me, even with my theological background, with my training, with the world religion history classes, and all of that. There's quite a bit of the finer details that I've had to learn. And this is important because if you're doing interviews like this, if you want to get better at this, it is important that you know that you don't have to know it all. We don't either. I often come across situations where I really have to ask questions because I'm not quite familiar with the details of where this person is coming from. I had a steep learning curve in the U.S. when I moved over there, getting into this job, learning the nuances of all the different backgrounds of the people. Yeah, I knew the theory, I knew the theology of it, and I knew it from the books, but the lived experience is different. I come from, in Iceland we have a pretty much, historically one set of Christianity, and that was all of what I knew on an intimate level. And then I had the experience of spiritual living through the fellowship of AA. So I had a lot of things to learn. And the important part when you're doing these kinds of interviews is curiosity. Be curious. Have your ears, your eyes, your heart, and everything open. Listen, observe, look. More than meets the eye, always. Pay attention to everything that's going on, the body language, and all of it matters. But you can do this work if you stay curious, if you stay involved, connected. Working with someone means connecting with someone. We can't work with people unless we really, really are curious and wanting to connect with. I mean, and in this area, it is super important that you have your ears and your heart open to what is this person really, really saying. So now, once you've gathered sort of the background, you feel like you have some background knowledge about this person's experiences in the past, where they come from, what things mean to them, and how they have been influenced by their family system or the culture at large. You turn your attention to the present. And this is super important with alcoholics and addicts, because whatever might have been in the past may not be real or present now, in the here and now. So you want to know about the current level of participation. And as many of you know, alcoholism takes you, or addiction, substance use disorder, takes you into quite a bit of isolation. So very often there isn't much of participation in anything other than drinking or using. But you gotta ask and know what is going on. What activities are you engaged in that are meaningful or spiritual or connecting for you? Sometimes people are holding on to something by a thread, and it's really important not to lose that thread and to really be able to pull that with them. Now, what are examples of experiences that you think of as spiritually meaningful? Where I work, we have the privilege of having quite a bit of acreage, a beautiful, beautiful landscape. We have woods, we have water, we have lakes, we have a lot of animal, wildlife, deers, birds, everything. And very often that environment lends itself really well to connecting and spiritual connecting. I joke and say that the little critters that are, running around there, chipmunks and whatever you name them, I had to learn that too, what they're all called. They are sort of my helpers. There are owls in the woods, and just the other day I had this young woman who this was, I think, her 8th treatment, desperately hopeless. It's not going to work for me. I will not be able to live through this. She took a walk in the woods, and just to kind of distract herself from the heavy-duty work that she was doing, and came back reporting that she'd seen 2 owls, 2 big owls, swooping by And she was at a point in her treatment where she needed to make a decision, a commitment to her life, to saving her life. Was reluctant to do it. I don't want to spend more time, in this, and scared beyond words to continue. But she saw these beautiful birds, started kind of reading up on it, and said, owls are about wisdom. And I think they brought me the wisdom to move forward and do what you people say I should do to stay safe. And so that to her was a tremendously meaningful spiritual experiences. And I had a young man not long ago who was kind of racking his brain about higher power. We talk about higher power and in a group, and he said, I don't know what that can be. And then he started talking about, water and surfing, and how he used to surf, and how he used to feel alive, by the water. And then after the session, he came to the conclusion that the element, water, could be the power source for him right now. I speak of a power source rather than higher power nowadays. Somehow it's evolved to that place. Jack talked about authority, for me, it is finding a power source or connecting to a power source that can give you what is missing in your own resources. So, and then styling, how does this person learn the best? What is the preferred way of connecting with this person? Are they, this young woman, who obviously didn't want to be like anybody else because she looked, quite decorative, colorful hair and, odd clothes, and obviously had made the decision to be the outlier, And she said, I don't want nothing to do with this spirituality business, and, you can just go ahead, it's not me. And then I saw her doodling and drawing. She was always making some little art pieces. And that seemed to be her place, her space, her power source. She seemed to be at one with herself and even with a group, because they were all admiring her beautiful work when she was doodling and drawing. And so for this person, sitting her down and having her read some words about spirituality was not meaningful, but having her make her own drawings and then talk about them and share them, you saw her light up. You saw her connect. You saw her come into, that was her preferred style of learning. Then I just want to mention also that there's nothing wrong, sometimes you hear this thing about, you have to engage their heart over their intellect, that the intellect gets in the way. And specifically with healthcare professionals, which is also part of the people that I work with, you get these really brainy, smart doctors, or neurosurgeons, or what have you, and all they can do is to think their way through problems. And you would certainly say that they would benefit from connecting to their heart, but sometimes you have to go at the heart through the head. So you can't, you have to really engage the learning style that they are, they've been, preferring for decades often through their education before you can, help them with the other types of connection. So here are a few examples of what we need to be listening for. Something that can help you when you're talking to people, help you connect with them. I wanna highlight out of this the artist. I trained as an artist. I had this gentleman recently. I visit with the people when they come in on the medical unit, when they're really, really shaky and having a hard time. And that's where my interviewing starts. That's where I start to begin my journey with people, observing them and hearing them, at their lowest. There was this beautiful young man sitting there shaking, but he had a drawing pad in front of him, and he was drawing this most amazing picture of country rock stars, portraits of those people. And then he said, I'm drawing the people that I know are in recovery. Good thing. And he, later on, as our relationship developed, I found out that he was not actually good at reading. So directing the team to not load him up with books and booklets and stuff, but give him more paper, give him a pen, give him more work to do with his art, and help him that way was very, very meaningful and spiritually to help him connect. Now, another one which is very, very common, I don't believe in God, and if you're going to push God on me, I'm gone. I'm leaving. You won't see me here. Okay, so that's fine. This is not a place where you have to believe in God. Well, that's what the 12 steps are all about, yeah, and there are quite a bit of God in the 12 steps, but let's think about this from a different perspective. We are trained to help people do that. So I mentioned the power source before, and I suppose that it speaks to me and it is authentic to me, and I think it's part of where I come from. Because where I come from, there's power everywhere. Under your feet, everywhere you go, there's power. There is heat, there is fire, there is ice, there is water, and there is just endless, and ocean all around, mountains to climb. There's endless sources of power that you can really be empowered by. So that's where I help people kind of through these interviews and pulling out from them what is meaningful, what has power, what has authority to them, and make a beginning. It's the water, it's the woods, it's the it's music. Very, very often people connect through music. It's not a surprise. It's been throughout all history a way for people to really connect. Drumming and those kinds of practices have been with us since the beginning of times. So working around the word is our specialty, as the God word is our specialty. And you can do this too by deep listening. Now, grief. I would say, and I said this yesterday in a conversation, I think 90% of the consultations that are handed my way through the team are about grief. But not just grief after people losing somebody. Those are the obvious ones. Well, this person came in yesterday and he lost a child 3 months ago to SIDS, and obviously that lands on my table. But then there is all the other types of grief. Functional losses, that comes to mind first. People in chronic pain. We get a lot of people with chronic pain who've gotten addicted to opiates and are stuck, and they grieve the loss of their functioning. They grieve. They can no longer do the things that they used to do. They're not the people that they were because of this either injury or illness that causes them constant pain. There's a lot of grief to be done there. So grieving is about healing. Grieving is a healing process, and it's a natural process. However, addiction gets people stuck in some sort of a loop in the grief. So very much of our work is to kind of help people begin the journey of grieving. Another type of grieving that often is very obvious with addiction is loss of family, houses, and material things. Although they're not necessarily the most important thing in the world, they do hold spiritual meaning for a lot of people. To have a safe haven, to have a place to call your own, to to have created something that's now gone. So all different types of grieving, relationships and things like that. The feelings that come along with that are things to listen for: feeling really guilty, not having done something or having done something, blaming yourself, resentments, this feeling of not being able to accept the unacceptable, and the powerlessness are frequent themes. And as we heard yesterday with Cindy and Miles, there is a strong linkage between grief and trauma, and sometimes I think it's a privilege to be able to help people with extensive trauma to find their way to grief and process their trauma through the grief process, through the experience of grieving, opening up for the tears and the feelings and the reality of the losses, and take that journey, not be afraid of it. And then I'm going to summarize here. So what I'm basically trying to convey to you is it is important to know the context. If you're doing a spiritual interview, it is important to listen deeply to the background. It is important to listen deeply to what is going on right now in the moment. And it is important to hear the high points and the wounds. So those are the main things that you as a professional can focus on when you're trying to connect on the spiritual level with an individual. I'm going to hand it over to Jack again. Thank you.
Thank you, Eyglo. It's exciting to listen to somebody who works in a peer institution and finds so much commonality in our experience. And I was saying that at the opening. That's what routinely happens when I have a chance to meet people who work in the spiritual counselor or addiction chaplain role. We have the same stories and the same there's a dynamic of encounter that I think is different, and yet I'm not always sure how to fully distinguish what our experience is as pastors and chaplains and theologically prepared people in this clinical realm. So it's great. It's a great challenge for me to see if I can help to do that as well. I think that each person who works in this field is different, and I know that there are lots of clinicians in various disciplines who do a great job with this material. And the likelihood is that I'm preaching to that choir. You probably wouldn't come here if you weren't already somebody who has that inclination to lean in. But I also want to tell you that in my work with clinical professionals at my own treatment site and in other treatment settings, I've seen a lot of people who either pull back or have what I think of as sort of curious approaches to religion, culture, sacredness, theology, and the invitation of the recovery communities, particularly those in the 12 steps, which are so important for many people in terms of finding recovery from abstinence-based approaches with substance use disorders or with behavioral and relationship addictive compulsive disorders. One of the things that we're finding is that the landscape of the recovery journey is getting a wider variety of offerings, and I don't know exactly what the European landscape is as much, but in the United States we have offerings like Smart Recovery and Life Ring and Refuge Recovery as examples that are, some of them might be disappointing for me to describe them as para-12-step, but I think in some way they define themselves in distinction to the 12-step communities, and yet they share similar characteristics, including group accountability and support and mentorship and all that. And in this area, frequently the psychologist, the addiction medicine provider, the addiction counselor, the social worker, the family therapist, the nurse, or the recovery frontline, less clinically trained staff will even be advised to kind of stay out of the spiritual as if it's some sort of third rail. Like I remember my dad telling me when I was traveling internationally I should not talk about politics and religion, and it's as if somehow we take that into the clinical sphere. It's like, well, we'll just let you figure that out on your own. You know, let's work with your depression, let's work with your anxiety, let's work with your use disorder, let's work with the family issues, but you're Jewish and I don't know anything about that, or I'm Catholic and I'm told I'm not allowed to say that, or, you know, like it's kind of it's an untouchable domain. And I want to both keep the mystery and demystify the sacred. I want to say that in some ways we need not be terrified of this realm, and that I feel like I always say things that then I'm like, might be a little controversial, but I'll say it. One of the things that's all the rage in the clinical dialogue in the United States is evidence-based practice. And I think that evidence-based practice is a branding of concern and that has reasonable and well-meaning people advocating behind it, because people have done things that are not grounded in good thinking and practice, and I understand that. And so, and in fact, I have been courted as the head of spiritual care in our treatment center for people who want to come in and do various kinds of practices, various meditation, prayer, breathing, Reiki, various things, and I often ask, what is the evidence behind this modality? And I'm not opposed to asking questions about evidence, but one of my concerns is that in certain kinds of inquiry, evidence manifests in a certain way. So certain questions that we ask lend themselves to statistical double-blind studies and to the tools of numerical and digital analysis. And there are people who have looked at qualitative research, but I think that there is an embedded bias and prejudice towards this idea that only questions that allow for themselves to be studied in a numerical and statistical method are able to be endorsed as valid. And I have a problem with that, because I think it flies in the face of sort of plain sense knowledge, awareness, and evidence. As an example, I will use the recovery movement. I think that there is evidence, if you take out your smart device and Google AA meetings in London and see how many there are. And there's an astonishing offering of 12-step meetings in London. And go to New York and it's even more astonishing, like how many of these meetings. And so there's a plethora of individuals who access this modality of treatment that doesn't lend itself well to double-blind analysis. But to refute that is evidence is, to me, actually poor science. In other words, that's a poor intellectual reductionism, because it's as if I don't want to look at the questions that raise themselves around this, because I can't have 50 people do something besides this. I like messy questions. That's what I've discovered. And I trained as a mathematician, and a physicist in my undergraduate studies, and I was enamored of mathematics and physics because of its precision. And I identified in that period of time in my life as an atheist. And I remember taking a class in Dickens and hating the class because it was so subjective. And I felt that the professor, who was very tough on me, later she would become a lifelong friend, but she had the nerve to give me a B. And what would she know about my capacity to engage with Bleak House? Maybe it's a claim I want to make about maturity and human development. But people who reach certain stages in life of crisis, sometimes even children with cancer, but also if you look at some of the great academics in my field, Thomas Aquinas is an example of a prolific scholar and writer many centuries ago who's had tremendous influence on the life of Christendom, and particularly the Catholic tradition, but also in many, many ways. Near the end of his life, quoted as saying, "Everything I've written is so much straw, like is relatively meaningless, and the only thing is love." And yet we still read the Summa Theologica, like as if it's, a refreshing take on Christian thought, which I think it is. My wish as I begin to talk to you about authority then is to confess up front that I am unabashedly enamored of messy subjects and of things that are complex and of entering the sphere where we're going to talk about things that may not be fully codified or lacking contradiction. One of the most profound moments for me, and I'll stop with the mathematics and physics and get into the content of the domain, but in my mathematical studies was that as I reached the more advanced levels of study before I left that field, was learning about Gödel, G-O-D-E-L, a mathematician who in the later part of the 20th century developed an elegant proof about abstract mathematical systems. And I thought of abstract mathematical systems as the realm of pure knowledge, like that this, if anywhere, was the place where knowledge would be tight. And Gödel's elegant proof shows that any abstract mathematical system, any geometry, any algebra, any calculus, will have either incompleteness or inconsistency. That you cannot have a mathematical system that's abstract and substantial that is both complete and consistent, which is remarkable, and challenging to those who come. Many of us as patients are like, I'm scientific, I'm a science method person, and that's why I can't do the higher power thing, or I can't do the God thing, or I can't do the spirituality thing. In the Christian stories, there's a fellow named Thomas who wants to see and know the resurrection story of the Christian experience to be true before he will subscribe to it. And one of the things I like to say to patients is, it's ironic, you'll eat brownies going into a Dave Matthews concert that you have no idea and what's in it, but now I'm going to tell you that you're going to try something that's going to work for you and help, and you want to scrutinize and know what the hell is going on, and you were shooting stuff in your arm, you had no idea where you bought it and where it came from, but now I'm not going to try that prayer crap unless you tell me how it works, and it's people are a little bit funny about that, and it's not just addicts. Many of us, we fly in planes. I flew in plane to get over here, and I've studied Bernoulli's principle of flight, but it's a bit of an odd thing to see this huge metal cylinder that is going to take you across the Atlantic, and we trust in it. And we find the proof in the experience, right? It's just like the AA meetings or whatever. We find the proof in the experience. I think that's as close as I can get to a good segue into the subject of wisdom. What is wisdom? I'm 57. I like to think I'm beginning to figure some of it out. I think that wisdom awareness comes from experience. And that's one of the ways why it distinguishes itself from formal systems of knowledge. My wife, I'm married for the second time, and she likes to describe me as one of the smartest people she knows with the least common sense ever. And that's because sometimes I lack wisdom. I exhibit really stupid behavior. And this graphic, which I think is lovely, comes from the work of a woman named Andrea Travers, who did a doctoral study on different religious traditions and the 12-step movement. And what she was trying to do was look at correlations between indigenous, tribal, Christian, Hindu, Buddhist. She has a cosmology category over there. This is Tao, Judaism, and Islam. Those are her the families that she looked at, and I think there are others. It's complicated to try and be comprehensive about how human beings transmit the sacred within their cultural contexts. But that's the question here, is how do we teach this domain? We know that we have learned to teach math differently. We teach language and reading arts differently. And we also have to teach about life. We teach about life through parenting. We teach about life. But that's one of the functions, I believe, of sacred communities, is to teach about life, about death, about birth, about rites of passage, about negotiating challenge and difficulty. And when a patient presents to a addiction treatment provider, we probably have different ways of conceiving of that. One of the things that Eyglo was talking about is the diversity of Christian expression in the United States. It's an interesting Wild West kind of landscape. When people identify themselves as Christian in the United States, that tells you very little, because it can be left or right, it can be liturgical or anti-liturgical, it can be casual or fierce and angry. There are so many different ways in which that's held. And as an example, one of the flavors of Christianity within the American landscape would view the person that comes forward in the community with an addiction disorder as very clearly in disobedience, in sin, and in need of repentance because of an idea of shame and stigma and of willful choice. Whereas somebody else may view that patient and say, with a very, very strong notion, disease. This person is afflicted with illness, generational social components, trauma, and all those things behind it, and would criticize the church community I was just speaking about for talking about that person's presentation as sinful, because they would want to say from a therapeutic modality, gosh, that would be like saying, it's your fault you have cancer, or it's your fault you have... Now, the funny thing is, I had cancer in 2008, and from 2008 to 2014, I was treated for bladder cancer, and I wanted to know how much of it was my fault, and the correlation was to cigarette smoking. I was a cigarette smoker for a long time. If you go into the doctor and you get a diagnosis for heart disease, there may be behavioral aspects of your life history that have contributed to the risk factors that you have. And yet, I don't think the doctors are like, this is their fault too much. It's not a great medical method. Motivational interviewing, which is a very important training that many of the folks in our treatment centers both, I think, have exposed to, has understood that pushing judgment and instruction on people results in very limited compliance rates. That telling people what they should do and what's wrong with them is not a highly effective method of eliciting participation in transformation of that behavior. But the reason I want to say this is that I think it is complicated. And I think that one of my mentors was this big sickness, not sin guy. And I'm grateful for addiction is disease teaching. I believe it 100%. I believe 100% that addiction is disease, that my brain suffers from a disrupted choice mechanism like Nora Volkow speaks of and I see it in my life. My wife tells me she sees it with me with Cheetos, or honey roasted peanuts, and that I still exhibit this peculiar sort of pleasure response behavior. But I also experience shame in relation to those behaviors. I feel regret and a sense of infidelity to the wisdom that I was imparted through the people who have had the most meaning in my life. And so when we enter the conversations of people's struggles with the sacred, simple understandings of how that works, or simple understandings of it's sick, not sin, so don't even worry about the sin, is I think a potentially a grievous error, because I think that those of us who experience the illness feel something that in certain religious traditions feels much like the shame of sin. And I think that people who take refuge in the addiction is disease may only be compartmentalizing. I think this is a complicated territory. And one of the developmental aspects of being a human being is individuation. We grow up as these very, very dependent little infants. Somebody was just citing yesterday that both a human infant and the more evolved mammals, without nurturing, will die. And if you just give it food and water and no nurturing, no love, no stroking, no touch, we will die. And that flies a little bit in the face of the early formulations of Maslow's hierarchy of needs, which identified love as like a higher level need. But we at a fundamental level need to be loved and to have relationship with one another. And so Eyglo, much as I do, spoke about connection as a fundamental question in this area of work, is where and how do people find connection? And when I used to teach about addiction in the beginning part of my 10 years at Caron Treatment Centers, I used to formally say spirituality is about connection and addiction is profoundly disconnecting. I think many of you would quickly go, yeah, it is. You talked about isolation as a feature of the illness. I know early on I would say to a patient, gosh, you're so lonely and isolated. And sometimes the patient would feel like, oh, you have so much insight. And I'd be like, no, I don't have any insight at all. It's not hard to figure it out. Like, you're shooting dope in a crack house or whatever. Like, that's pretty lonely and isolated. Like, it's not rocket science that it is. But recently I was working with a group of our older adults, and I owe it to one of the patients there who wanted to stress how profoundly connecting her addictive experience was. And I related to that. I know that when I reached for the bottle of Johnny Walker on the top of my refrigerator, it had a sacred aspect to it. The crack of the metal ring and the tinkle of the scotch on the ice cubes and the rush of the first sip of the drink I'd been waiting all day for going down my throat was a connection I had craved, quite literally, all day long. And I think that it is my new formulation to say addiction is profoundly misconnecting. That what Dr. Volkow in the National Institute for Drug Abuse, who's done some helpful brain studies on addiction and has a lot of influence in American national drug policy, which I have some worries about. But she's a fine researcher and good soul. Talks about it as a disrupted choice mechanism. Doesn't mean that the choice mechanism doesn't work. It means that it's fused to the wrong choices. We are incapable of rational decision making, but we are profoundly attached in toxic relationships. And just like people who are in battered spouse situations, or folks who become attached to their abusers and other sort of things, we in many ways are that. By placing myself as a person in long-term recovery, what I mean to say is, I got myself in a toxic relationship with Johnny Walker Red, and I came to be dependent on it and loved it and hated it all at the same time. And so today, one of the things that's interesting is this movement that we're going to talk about a little bit, the 12-step movement, begins in the United States in 1935, and in 1939 it has its principal writing of the first major document, which was the book Alcoholics Anonymous. People in the movement at that point are only up to about 4 years into their recovery, and the lens with which they're viewing the experience is clouded by a variety of cultural, contextual factors and gender and all those sorts of things. And they do not yet really have in view. It's fascinating to read this Alcoholics Anonymous text and pay attention to what at Caron Treatment Centers and in some areas of the industry we call addiction interaction disorder. To look at gambling, to look at smoking, to look at sexual and relationship acting out, or sexual anorexia, and self-injury, and all these other ways in which the brain's mechanisms of disrupted choice can also become dysregulated. And see, I know in myself I've had to address recovery in a variety of different areas, including around work and food and sex and relationships. And I selected the Pied Piper image because of this new sense that misconnection is a really helpful way of talking about what's going on. That people have become lured into toxic relationship is a way of thinking about addictive disorder that I think has value and meaning. And I think one of the things that's really helpful about it is a relational model rather than a solely individualistic model. It locates the problem at a contextual level and moves us into more of a systems thinking rather than an identified patient kind of way of thought. That what's happened has to do not only with me, but with the soup in which I experience the world. So, if this is true, if addiction is and addictive disorders are misconnecting, then our challenge as spiritual care and as practitioners in other disciplines is to cultivate healthy connectedness. And in some cases, it is really tough to break those bonds. And we know that's just as true for the diabetic with their eating disorders, for the person with chronic heart disease. And interestingly, in those areas, we track success as improvement, not as absolute perfection. Whereas somehow in this standard, when people, when there's recurrence of use of substances or whatever, we're like, you failed, and we have a very binary sort of understanding of this chronic presentation of illness in comparison with other forms of chronic illness in terms of how we measure outcomes and successes. And I think that there's a lot of room for us as an industry to grow up to reckon with the way in which even a person who stays abstinent from substances may be very, very much not really in healthy connection yet. May be still profoundly misconnecting. and where sometimes a person who has episodes of return to use of a substance may, on the other hand, be comprehensively addressing connectedness and doing like better than you think. So I think that connectedness is an area where we could look to develop meaningful outcome studies that were qualitative, and where it's not simply did you drink or did you not drink, did you use or did you not use, but rather are you socially functioning, and do you have this experience of tribe and belonging and mentorship, and do you know about who you are? I thought one of the things that was interesting, and Eyglo, I'm going to do Eyglo therapy for a minute, which is really inappropriate, but she said, I'm a stranger everywhere, right? Which is often the expatriate's experience, but it's also often the addict's experience. Not feeling at home in their own family of origin, not feeling at home in the workplace, not feeling at home in the street, not feeling at home. And this capacity to feel at home, when a person is profoundly connected, they will be more resilient and handle life's difficulties better. And they'll do that because of not a singular connection, like not I found the woman of my dreams or the guy of my dreams and he's my everything, but because I have a kind of a broad network of places and forms and sources of support. And so parents and grandparents, civic and social leaders in institutions, religious or spiritual advisors, and employment recreationals, that's what a comprehensively well-connected person manifests. And so one of my challenges to the industry and to the critics of spiritual engagement with clients is people who say to me, I'll meet someone on the plane and I'll say, you're having the casual conversation. Finally, they say, well, what do you do? And I usually say I'm an addiction chaplain because it's a 2-word descriptor that gets pretty close to the heart of what I do. But I'm always fascinated by the reaction because people often kind of get quizzical and they're like, what is that? And then the next question is often so revealing. It'll be like, does that mean you do Bible study? And I'm like, oh God, okay. That's where we are. Or I remember one person said, did you like crystals? Energy? And, underneath of that, am I just another Pied Piper, I think is part of the question. Am I a marketer of some sort of healthy misconnection? Because of unhealthy connection. There are unhealthy religious connections, by the way. And there have been some people who have done, Leo Booth and others who have done some really nice work on religious addiction. And one of my friends in California, Ingrid Clayton, who wrote a book about spiritual bypass. I don't love the term, but the notion is important of the idea of using religion as an evasive and avoidance mechanism rather than as a healthy process. But I do want to say religion is not flaky, or spiritual care is not flaky always. It's not always flaky and stupid and unsubstantial and unvaluable. And in fact, when people are effectively and meaningfully connected, they do well. And when people are profoundly and toxically misconnected, they do poorly. So this isn't optional, and it's not flaky. We do have to make sure that we can practice the craft in a way that allows people to do it non-religiously. There's an ethical absolute there that whoever practices in the work of the spiritual has to help people become spiritual atheists. There are such things. And that we shouldn't take the Jewish person and tell them that they should suddenly become a Buddhist, which sadly happens all the time with the refuge and other sort of, like, there's a lot of proselytizing that goes on that is not just in the traditions that are often criticized for their proselytizing behaviors. And but it's important to ask, where do or could you belong? And what source, I like that word, Eyglo's word of source, can you draw from? Because in spite of, and I'm like this true blue, red-blooded American boy, white and heterosexual and, a child of privilege, but I inherited, because of those circumstances in my life, a narrative in my country and culture of radical individualism. When I was a young boy, I remember my dad telling me how important it was for me to be able to make my own decisions and chart my own course and author my own life and be my own person. And even though they were, they would baptize me in the Catholic tradition of our family and childhood, but my dad was also embraced this radical intellectual freedom idea that applied even to religion. So he's like, you go and find out what you want. And underlying that was, I think, a sadly lost value of belonging. My parents are both long dead, and I'd love to have this conversation with my dad alive today. I've had it with him in dreams, but to me, I believe he was also profoundly misconnected. And so he didn't know to tell me that I should worry about who and where I belong. But people need belonging, and I'm not embarrassed to advocate for it. And addiction treatment that doesn't attend to belonging is lacking. And if you think that the first and last of that is the family of origin, I'd like to show you some families that you should be a little bit hesitant to be recommending as the primary source of connectedness, because they're nuts. There may be a day when that family can learn to manifest connectedness. But it's as if that's become, and I'm so grateful for, if you think about Raquel Lerner, she's an amazing pioneer who is at this conference, and there are other people on whose backs we all stand who brought family into addiction recovery. I'm not saying that we shouldn't have family programming and that family isn't important. It absolutely is. But it's as if we think we've met the need for connectedness when we address mom, dad, significant other, children, and siblings. And often those are some of our most toxic and painful and wounding relationships. And in human development, one of my jobs is to fledge from the nest of my family and become also my own sort of head of household or participant in all those sorts of things. And along the way, I can't just become totally untethered. So the spiritual interview that Eyglo was talking about correlates with the provision. Well, I think if you want to wade into this area, you have a responsibility to have at least knowledge that there are multiple sources of wisdom, multiple contexts of belonging, multiple construals of authority that work for people overall. And they all have bad actors. They all have, abusing and excessive practitioners. They all have hypocrisies, just like we do. It's one of my favorite little AA stories. A guy and his wife. The wife is in Al-Anon, classic formulation. The guy's getting sober. He's got a sponsor. He comes to a sponsor and he says, "My wife wants us to go to church." And the sponsor says, "Okay, so what's the issue?" And he said, "Church is full of liars, hypocrites, and thieves." And the sponsor says, "Well, you should fit right in." And it's interesting, Bill Wilson points this out in some of in I think it's in chapter 4 of the AA Big Book, where he talks about how odd it is that in the beginnings of Alcoholics Anonymous, so many of these, they were low-bottom drunks with terrible lives, and they were casting aspersions on the religious people in their sphere. And Bill was like, well, it's a little bit ironic, like from the gutter, boy, he's got a screwed up life, like, really? Okay, huh? How's that working for you, So, unfortunately, there's a terrible trap, which is coercion, in which I decide that this is the proper authority for you, where I tell you that the source of authority you must go to is, whether that is the Bhagavad Gita or the Christian Gospel or the Star Wars epic series, it's the decision that I know what your source of authority should be that is unethical. But I think that we can handle that. I think that doesn't mean we should not go into the work of it. It means that it's complicated. And that occasionally we'll have a patient. We were just figuring out how to do a better job of accommodating Muslim patients in Ramadan, because we have a limited census of Muslim patients. So we do, in my treatment center's environment, we do a great job of accommodating Jewish patients. I think a really great job of accommodating most Christian patients. But the Islamic and the Hindu percentages are lower. And so, and one of the things we have to do is staff education, because the dining hall is like, well, we have the food. I'm like, yeah, but time of day is an issue for this person. And actually community. Like if you're going to observe Ramadan, the really nice thing is to break your fast with other people who are also fasting with you. Otherwise, you're only getting part of the experience. And so there's a responsibility to do well in this area. And there's a urgency about it because this matters. This matters in a huge way. I think when you were talking about the atheist patient who says, well, there's God all in that 12-step thing, I think sometimes helping patients understand that formulation in 1939 placed God as, in my mind, almost a placeholder for this deeper idea that belonging matters, that authority matters, that wisdom matters, and that on our own we don't do well. And it's tricky because my mentors, some of them were old school AA, were like, their way of picking on someone, I'll pick on Eyglo because she's a friend, but be like, you're dumb, you don't know anything, sit down, shut up, take the cotton out of your ears and put it in your mouth. And they thought that was an appropriate way of telling her that she needed wisdom. And it turns out that only works for a small number of people who actually like to be sort of yelled at, right? And there are a certain number of people for whom getting yelled at is a great way of teaching them. And that may relate to their family of origin stories or whatever it is, I don't know. But for me, the ethics of it require me to be cautious about issuing an invitation and helping elicit motivation, and that begins by helping people recognize their own need, which is absolutely in there. I'm one of these naive idealists who believes that even the person who sports an antisocial tag, or a borderline personality diagnosis, I always want to believe that that's not merely organic, although of course there may be organic pieces, but that it's my faith that tells me that there is the capacity in that person to connect. I want to believe that. I'm going to believe that about every patient that I see because I have to believe that. And there are cynics among us. I had another mentor, a physician, who said, what do you do when the antisocial borderline person comes in your office? And he said, lock the desk. And I appreciate the need to be cautious in those encounters. But to me, that's tragic. When we get to the point where we have given up on the hope of the people that we're working with, manifesting this fundamental thing, because I think we are mammalian, and there's something in us that knows how to do this if we can just rediscover it. I'm talking too long. I talked a little bit about the 12 steps interweaving in here, but I had a guy I really admire, just was speaking with on the phone the other day, who has been at the Hazelden main campus where Eyglo works for many, many years, is moving into retirement, a guy named Fred Holmquist. I don't know if any of you know Fred, but brilliant guy. And Fred has a very intellectual style. He's not a conventional religious adherent. And that made it fun for me to get to know Fred and to banter with him about the 12 steps. This is a copy of a page from one of the original manuscripts. I think this is so interesting. This was the 1939 published document in a manuscript that was handed around. You can see all the editing. It's a bit of a community collaborative document. But what Fred Holmquist helped me many years ago to start me on this train of thinking was his proposal that the AA movement can be thought of as a contemporary wisdom tradition. And I think that's really helpful. And even though it makes some people nervous, I always say people are like, well, you've just been brainwashed, or you're just in a cult. And I'm like, I think I'm pretty good with that. Like, there are definitely cultic features, and I think that human beings are cultic beings. I think we all need senses of tribe and place and belonging. So the dues and fees I paid in advance to get into AA make it cheap for me. I pay $1 a day kind of thing, and it's been a healthy context of belonging for me. And I think that there are also other interesting contemporary sources. So to support the argument that AA is a contemporary wisdom tradition, if you want, there are pilgrimages to AA historic sites, which I think is that's pretty interesting. So, and people are like, Bill made the phone call from this phone booth, or it's like a big deal. And Henrietta Seiberling was on the other end of the phone, and it's. If we understand it as a contemporary wisdom tradition too, then maybe we can be friendly to its idea that it's going to evolve some variance and have some diverse offerings. Because I think there are today the other thing that exists there are AA fundamentalists. There are many people who are like, this is the only and right way to observe this. And of course that's happened in every religious movement in history. But I do think that we also have to acknowledge, I thought that Eyglo's conversation about the natural features of the campus at Center City in Minnesota, very much like our setting, is a mountaintop setting and a place of extraordinary beauty with these magnificent vistas. And the natural campus provides a context for spiritual awakening and connectedness for many of our patients, although not all. I was telling her about a person who was suggested that they go fishing, and they were like, ew, and you have to realize that not everybody connects in the same way. But there are wisdom sources that are non-religious and deep. There are deep wells of wisdom and connectedness which can serve people for whom particularly there may be religious wounds that have the feature that in order for me to feel healthy, I need to not go back. Like some people will say, you know what, like what happened to me in my early Judaism or my early Catholic or my early Bible-based Christian or my early Hindu or my Scientology experience or whatever, it's like I can't do that. Like part of me being healthy is I'm not going to put myself under that kind of authority anymore. And so reading Emerson or Eckhart Tolle or something like that are really nice options for people. And part of, again, the ethics of spiritual care is now to have this also in your arsenal, to have things that are grounded in science and spirituality. And some of this, this appeals very much to me because, as I said to you, I had a physics and math background. So I I was so happy. I Googled. I wanted to find a picture of Gandalf and Yoda sitting together. This is my perfect idea of wisdom. Like this is the Jack Abel school, right? These two characters express and articulate wisdom to me because I am a child of our contemporary media culture, and I will tell you, many of the teen patients that we work with. We're starting to not use the word adolescent because our adolescents feel like it's insulting to call them adolescents. But our teens are really understanding wisdom in a media-driven way. And Marvel and Avengers and superheroes. And I could make fun of that, but I have to tell you, when I was a child, every year I would take the Tolkien trilogy with me to the beach and read it every summer. And when Star Wars first came out, I was just as glued to that story as many others would be, although now I watch the movies and I'm a little perplexed by it. But this is the counterpart. So the two pieces of what we've done with you, and then we're going to talk a little bit about practice, is interviewing the client and having an understanding of what connectedness looks like. Connectedness to what? What are the sources and streams that we have the capacity to help people make connection to? And if that's monolithic and singular, we're not doing a good job. We have to have a rich panoply of the pyxis of the spiritual care practitioner. That's a thing that dispenses medicine for medical practitioners. Our prescription pad has to have a bunch of different options on it in order to be ethical and fair and to do the best job with the people that we work with. But it doesn't mean we should avoid the terrain. It means that we should lean in an ethical and appropriate way. I'm mindful of having talked for a long time, but I think we're actually doing pretty well here. So what we're going to do is, yes?
It says it ends at 11. And it's past 11.
Oh, it's past 11. Then we're done. I think I'm not used to reading my watch. No, it's good. I can't believe we talked that long, so that's fine.
Well, yeah, we did. We got a lot to say, but I want to say a few words at the end, or most importantly, if there are any questions, I would like to hear from you.
Or we'll be up here.
Yeah, we can stay longer for questions, but I want to say one thing here at the end. When I was talking about being always nowhere, and Jack is, being a therapist to me, if I was the patient, that was sitting opposite Jack, he would find out, if he listened, that I grew up in a small fishing village in Iceland that had 3 power sources in terms of spirituality available to me every Sunday, which was very unusual for that little, country. There was a Catholic monastery or sisters. There was a Pentecostal little church, and then there was the Lutheran church. So I think it set me up for this always being nowhere, or on the other side, being totally open to different ways of practicing, different ways of worshiping, and how open we need to be to accommodate and to help people make the connection that has happened. And I just want to say here, as in closing for myself, that for you all going out, be curious, listen carefully, and be present, and don't count out anything. Just be there for the person that you're sitting opposite, looking them in the eye, being there for them, and listening deeply. Thank you.